Friends, welcome to Time with Thebsian. Today's topic is about catheters. Words like a urinary catheter, Foley catheter, cardiac catheterization, catheterization for stenting, etc. very common words for us. Catheter at present is a soft tube made of plastic material that can be inserted into the body of a patient. So it is a medical device and it is prescribed by the doctors. There are two types of catheters: indwelling catheters, external catheters. These are the two types of catheters. And another difference is that this can be a short-term catheter or a long-term catheter. Usually, the catheters are made by pouring the raw material into a room temperature mold, which is similar to vulcanization, and the mold is made of the desired shape and diameter of the catheter. Benjamin Franklin produced the first catheter, and his catheter was made up of metal. After the metal catheters were made up of latex, that is a rubber, which are biocompatible and flexible to suit the requirements of the catheters. But the whole problem appeared was many of the patients were allergic to latex. Doctors were looking for another material and PVC came into the picture. This shows examples of rubber catheters. Red rubber latex is thermosensitive, which means this catheter metal easily warms up to the surrounding temperature of the body and it becomes pliable when it is pliable. Some people prefer flexibility of red rubber latex catheters, while others have more difficulties with irritation and there is some problem for insertion. We know the fact that many of the materials, especially in the case of catheters, the sensitivity is personal, related to each person. One doctor may prefer latex catheter, another doctor may prefer catheter made up of something else. Vinyl catheters became most popular because they were made up of transparent, clear, foam and pliable. And the catheter, once it should become soft and more pliable, it should need more phthalates. Phthalates are toxic. Vinyl catheters were foam, at the same time flexible. They are clear materials. They can be color-coded. See, the patients also have likeness or unlikeness regarding the catheter, because some catheters they like because it is very pliable and they don't feel much while insertion, whereas some catheter materials they feel pain. These are some examples of angiography catheters. For angiography we know there should be different catheters of various sizes and flexibility. This picture shows how a cardiac catheter works. This shows the process of cardiac catheterization. This picture shows the blood vessels in the brain when injected with a dye through a catheter. Silicone is one of the top materials of choice due to being tested highly biocompatible. It is a super smooth material, transparent, and flexibility lies somewhere between the vinyl and the latex. It is latex free, further it is DHP free too. And it is also very clear for viewing, equivalent to PVC, and some brands feature a color-coded tubes indicating the different size for identification. The toxicity of different materials that go into the fabrication of catheters are tested and certified by the manufacturer. Reuse of catheters is not recommended clinically, but reuse is carried out very often depending upon the management of the hospital and without the knowledge or with the knowledge of the patient who is undergoing catheterization. Nobody knows. Why catheters should not be reused? Catheters are intended for single use. To reuse a catheter, there are different processes to be followed. That is, first is cleaning, second is sterilization, third is packing, fourth is opening for reuse, and all these four processes cannot be carried out in a hospital premise because these are done in a factory in a mechanized way and not hand process. Why hospitals follow reuse of catheter is still unknown. It is unethical. So, we being the customers, it is our duty to say that the hospital use a new catheter every time when it is applied or used in you or your relative. That is Rule 1. Rule 2 is if it is cardiac catheterization or stenting, you have to get the receipt for the original catheter with the date and time. You keep your receipt and the payment receipt too. First you have to get the details of the catheter that is used, manufacturing date, catheter number, which company has manufactured it, who recommended the catheter and who used that in the patient. Because if something happens to the patient, the catheter can break if it is reuse of that catheter. So as customer, we have to be very careful with the use of catheters. The final point is that the topic of interest is the environmental impact of waste that accumulates after the use of a single-use catheter. It is every year it is in millions of kilograms of weight, especially the urinary catheters made from non-biodegradable materials like polyvinyl chloride. The whole problem is that these waste should not go to the landfills. They should go to the particular center of waste management where non-biodegradable pathologic wastes are accepted. There are centers in each districts of the country where you can dump waste materials that are pathologic, that are hazardous. And they have special rules, packaging and storing of these devices in these landfills. So friends, catheter, let it be for anything. There are thousands of catheters in different modes of use in the medical area, in the medical field. So listen carefully to this topic and be careful when you are prescribed a catheter or when a catheter is used onto you. Always get a prescription from the doctor and the details of purchase and payment of your catheter. Because sometimes, if you are unlucky, it will be useful for a legal battle. Because as customers, we have to start doing this, then only the medical management, different hospital managements will become more cautious about using repeated use of catheters, which entitle the safety and health of the patient who do not pay any attention to the hospital procedures of using used catheter, at the same time paying for the fresh catheter. Thank you very much, friends, for listening to this video. Let us meet next Friday too. Kindly listen carefully or repeatedly and send me your questions. We have to be conscious of the customer interests. Thank you very much.